Hi everyone, how are you doing? I'm Dr. Gail. Thanks for joining me today. Simulcasting on Skywalking with Moon and Galactic Gaia. For those who have not subscribed to Galactic Gaia, eventually this show will just be there. If you go and subscribe to it, it is Galactic Gaia 4VS. If you go ahead and subscribe to that, I'd appreciate it. I'm sorry, I do have a cold or sinuses going on. I have throat lozenges on one side, water on the other, and if I go through a coughing spell, I'll have to end the show. And I do apologize early if that does happen, but I'm prepared to try to go as long as I can without going into coughing. I feel pretty good. It's just my voice struggles with talking, and it's been struggling for a few days with talking. So let me say hello to everybody, but welcome to the Solaris Healing Center. Everybody has already started getting their healing. You've got blue light shining on you. I work with the extraterrestrials or the aliens or whatever you want to call them. And the Solaris Healing Center is a place where we go and get healings with it's actually your guides, your masters, your angels. Everybody goes there to get their own healing, and we're allowed to use that same kind of healing today. The blue light shining on you, your nervous system is relaxing, and your own healing is occurring. So, also the person you'll hear me mention a lot is Medical Mike, who works with me directly. His name's Medical Mike, or that's what we call him, his affectionate name, kind of. But he is an ET that is a human gray mix. We call him a gray hybrid because he does look more gray than he does human. And he is assisting me here today. Or I keep saying he's assisting me. His role has changed as where he is help. I would say we're collaborating more than assisting. In the beginning, he was assisting me. Now it's actually he's able to do a lot of things. But let me say hello to people who come in. Hey, Gary for Grace, thanks for being here. Hey, GP 3322. Hey, Perpetual Spiral, thanks for being here today. Hey, yet another Linda. Hey, Suzanne, and thanks for your message. It's always a sweet message. Hello, Dr. Gail and the community. I'm sending love and hugs to you all. Thank you. And if anybody wants to know more about the Solaris Healing Center, I have written 2 books. And the one that the Solaris Healing Center is in How I Met an Alien. You can find out more details about that. And of course, my first book is How I Learned to Fly a Spaceship. Both these books are on Amazon, and you can find them there. But the Solaris Healing Center I've written extensively about in my second book. But let's see, Suzanne, let's see your message. Hello, Dr. Gail and community. I'm sending love, hugs to you all. Thank you. Appreciate that. Hey, Mousy Girl. Hey, Sarah. Thanks for joining us today. Hey, Barbara Hart Love. Thanks for being here. Hey, Nancy. Thanks for joining us today. And let's see who. Rossi, you're here. Thank you for being here. Hey, Son of Watt. It was good to see you. Hey, Stardust. I'm glad to see you. And let's see. I'm starting things as I go. Today, I don't have Terry with me. She's out of the country. I'm visiting her brother right now. So she'll be back next time. Today I'm on my own, and I'll do as much as I can. I probably will not be able to follow the order as well today. I'll probably be all over the place. So don't anybody take offense if I don't get to your question, or I don't have time for your question, or I skip over your question. Anything above is not on purpose. It's doing the best I can. Okay. So just bear with me. All right, let's see who else is here today. Let's see. I saw Rossi. Hey, Liz and all, thanks for being here. Hey, Emmy J, thanks for being here. And R Santa, thanks for joining. Hey, Nissy, thanks for being here. And Linda Kelser, thanks for joining us today. Okay. And everybody, you are already getting a healing. You're here. You're being exposed to the blue healing light from the Solaris Healing Center. And so everybody is already starting to get healing. And hey, let's see, SSW, thanks for being here today. Hey, White Dragon. Hey, Emmy J. Oh, hey, Patricia. Thanks for being here. And she's putting the announcement in. Hello, Dr. Gail and Galactic Tribe. Please place your healing requests in caps. Like and subscribe. Thanks, Patricia. Sorry again for my voice, everybody. I'm going to go as long as I can with my voice. It will give out on me, I'm sure. I'm suffering with sinuses, cold, or something. And today we are talking about, let's see, when we got Elsie Geese. Hey, thanks for being here, Elsie Geese. And oh, Elsie Geese, this is more about um, healings, things that are bothering you these days. I'm going to be answering questions. I have different guides for this type of show versus ones I'm talking strictly about aliens or ETs. I have different guides for that. So your question will be more appropriate for all about alien shows. Today is going to be more healing questions and seeing what kind of things are going on with people's ailments, things like that. But everybody is already getting healing, and none of my answers supersede your medical doctor's uh, orders. I'm trying to think of the word. Your medical doctor's orders. I'm trying to read, talk at the same time, and so yes, nothing supersedes here what your doctor is asking you to do. So just be real discerning about that. Yes, Liz, and I'm also should be on Galactic Gaia channel. It should be going over there at the same time. If everybody will go over there and subscribe to that, that is actually the healing show that Terry and I have started. That eventually all these kind of shows will be going over there. Hey, Jules, learning to listen. Great to see you. It was good talking to you the other day. Hey, Gary, thanks for being here. Okay, Gary, again, this is more towards healing today. Gray. Oh, don't apologize. Well, I have to apologize for my voice. I really debated for a long time if I should even come on today because I knew I was going to be struggling with my voice today. Which, on the other hand, hey, Alice, thanks for being here. On the other hand, it has been a good thing because I have done a lot of writing this week because I haven't been able to do much things on YouTube because I didn't have a voice. So I'm going, I think my guides might have been doing that. So I get this third book out. So anyway, oh, Patricia, you don't have a medical doctor as yet. Well, good. That means you haven't needed one. Okay, let's see. What is this? The squad? It keeps on going. What is this? Hello, Dr. Gail. I meant to happen to be here with you all this moment. It is a wonderful feeling. Call me MJ. Okay. All right. Hey, MJ. Thank you for shortening that for me. Let's see. I'm keeping on starring these questions. I've right now got a lot, and I'm not sure how long I'm going to be able to last on these questions. Hey, Brenda, thanks for being here. But I'm going to go ahead and get started on them. See as much as I can do. I'm actually Michael Mike will probably be picking up the slack, but because it is just me. Hey, Denise, thanks for being here. Oh, have I tried throat tea for soothing? Oh, yeah, Denise, I've been doing everything you can think of. And tea has been the number one thing that I've been doing because it's so nice and soothing. In fact, I should have had a cup of it here, but I don't. I've got throat lozenges, water, ready to go for it when my throat gives out or when it starts acting up. But I'm hoping I can at least make it through a few questions to help some people out. But if I don't get to you, don't feel like I have done it on purpose. Don't take it personally. If I've missed you, skip you, anything, please don't take it personally because it is not meant to be personal. It's just sometimes my guides, I think, make me see or point me in the direction of they think who I need to see or talk to or do next. So just really don't take it personally if it goes out of order, especially today when I'm by myself. Okay. Let's see. Okay, I'm going to go ahead and get started. And I hope I have said everything I needed to say. But as let's say this is Gary first. Please, body scan, need healing, sleep apnea, diabetes, lungs, root chakra. Oh my gosh. Gary, I think that's a little more than this show can handle, but we will do. Oh, thanks, Rossi, for putting my books in there. I do think that my guides have helped me out because I wanted me to get my third book out. So since I haven't been able to talk much, I've been able to do a lot of writing this week. So I'm going, I wonder if they did that on purpose. But Gary, this is a lot. This might need to be on a personal uh, um, reading than here in the chat with all these, or maybe we need to adjust one or two and then come back again and we go to another one. But this I could do like a whole show on you just right now, just on all these things. But I'm going to go and see what I can see right now because all these different things. I mean, just are just different places to go. Um, that I probably need to get a deep dive because I'm hearing there's probably some psychological issues that are underlying here that need to be addressed, and I'm getting a big yes on that. And it's not just your root chakra that needs to be do some work on; it's your heart chakra, solar plexus, say all the bottom ones, all the bottoms that require safety is what I'm hearing. All your lower chakras requiring safety. So there's a big issue with you with feeling safe. I'm not sure what that's about, but there's some issues with you being feeling safe, and so we're needing to address that first. And needing, and so we're going to look at the root chakra first, which is what you have addressed, and I'm going to send you some stone here for this root chakra, and this is the septarian. It's a stone I got in Mount Shasta. So I'm sending you the stone to help with the root chakra, but it's all the ones from your heart down that seem to really need some attention. So as soon as I finish with this, I'm going to take in a little stronger stone that is going to they're wanting to be send this bright pink one, and it's more of a clearing of everything out is what they're telling me. But Gary, you need a lot more attention, and it's not the attention of each individual thing that they're telling me. It's as I said, it's a feeling of a safety issue. I don't know what has happened to you in the past, but it feels like it's a safety issue that needs to be addressed. That's going to help with everything else. I don't know. Does that make sense with you, Gary? Are you here? Okay. So, Gary, if you want for us to go further into this, why don't you contact me at Dr. Gail Starseed at gmail.com. Again, Dr. Gail Starseed at gmail.com. But it looks like it's safety that is the issue. Oh, you're here, Gary. Okay. Safety. Is there something that has happened to you that not made you feel safe that you haven't faced or dealt with that you're needing to address? It might need that you need to go into some kind of therapy over it, or maybe going to a shaman over it, or but it looks like to me there's the underlying issue that is causing a lot of this. And then it's after we get hold of the underlying issue, then we can start looking at these other things that are bothering you. So does that make sense, Gary, to you? Okay. All right, let me see who's next here. It does make sense, Gary? Okay. All right, good. So anyway, um, we need to address that first. And a lot of these other things are going to maybe take care of themselves or be lesser. I'm not sure what they're saying, but they just keep saying safety. We need to address the safety issue with him first and his lower chakras. So you were knowing that it was your your root chakra that needed help, but it's all the lower ones. But it's coming from a safety issue. Okay, let's go to the next one here. All right. AGP 3322, may I please have a scan? Thank you. Love you. Oh, thank you. I appreciate that. I can use all the love I can get right now. Oh, anytime I can. So, but thank you. Hey, Patricia, you're also getting that he needs to be grounded. Gary, yeah, the grounding is an issue, but well, grounding it would be part of the safety thing. That something's happened with his safety, and he's having trouble with the grounding. It's all four lower ones. But you're spot on. You're welcome, Gary. So if you need to get a hold of me, just contact me at Dr. Gail Starseed at gmail.com, or either a shaman could help you with that. But there looks like to me there just needs to be a little more deeper dive into all that. Okay, so all right, GP 3322. Let me see what you have here. Well, they're showing me this green stone, and it's not unusual for me to show this green stone before they show me the chakras that have issues. So when this stone is the color that they're showing me, it looks like it's the connection between your solar plexus and your heart chakra. So this is what they're showing me, and that's usually what I use for that is the connection for the heart chakra to your solar plexus. I'm writing this down. Okay, so I could see why is that? What has happened? Oh, okay. All they're saying, GP30, is you're learning to connect those two. You're learning. You're transitioning, it's the word I'm hearing. You're transitioning into learning how to connect those two, your heart chakra to your solar plexus. You're getting more confidence in the way you talk, and you're being able to speak more from your heart. And they're actually congratulating you on that. And that was actually the stone they pulled out for a little bit of a tweaking so you can carry on for what you're doing. So congratulations, GP33. It's your solar plexus, heart chakra, that needed a little bit extra to it, and they're congratulating you on being able to speak more freely from your heart. And it's almost like you're just coming out of maybe they're showing me like hibernation, like you're blooming, and that you're able to now start speaking a little bit more from your heart. So congratulations, GP3322. We don't usually see that often, but congratulations to you. That's great. Okay, perpetual spiral. Oh my gosh. Theodore, my cat, has an ongoing facial abscess resistant to antibiotics. Oh no. He's getting a head CT scan this week. He can use a boost prior to probable surgery. Oh, so sorry. How old is he? Let's see. Let me see how old he is. Um, I'm I'm seeing that actually his immune system's compromised in itself, and I'm getting a yes on that. That's why this facial infection is won't go away and is resistant to antibiotics. They're saying immune system compromised. Is your cat diabetic? 12 years old. Is he diabetic or she diabetic? I think there might be something they're missing. 12 years old. No, no, all labs are great. Okay, yes. So I feel like there's something they're missing. But I think if his diabetes is not showing up, I think it's right at the beginning of it because I'm getting diabetes. There is a great pet psychic that I've worked with my pets in the past that probably can help you nail down more about that. I'm looking up her name right now for you because I would like for you to get another opinion on that. let's see. Whoop. I'm not doing a very good job finding it. Karen, her name is Karen. Karen, I'm going to find it. Karen Dindy Smith. I'll write this in. Karen Dindy. Karen Dindy Smith. Take a look at her website and she is, oh my gosh, I'm getting ready to cough. She's excellent and she probably can help you out that, but I feel like they're missing something. And I'm getting diabetes. I'm getting ready to cough. I'm going to put them. I'm sorry, everybody. Okay, back. Patricia, you're getting the teeth. Well, that's a good thing. But you know what? Patricia, check to see if you're getting diabetes because I'm getting diabetes. And it might be just that it's not showing up. Hey, Nancy Jean. It might not be that it's showing up yet, but I'm just getting that it's diabetes. And I would love for you to maybe talk to her or get a session with her. Her sessions will do all your pets, and I'll say she does a session on you. It's everything. You feel low energy, yeah. Head and X-rays, head and X-rays is okay. CT scan will show to, yeah. I, I'm actually going through the same thing with my dog. There's something going on with her, and I can't figure it out. And I do have a session scheduled with her on this coming Friday to help me because I feel like everything's showing up normal with my dog, but there's something wrong. It's not like you where you actually see something wrong. So I would, um, Patricia Karen is an associate of yours. She's great. Oh my gosh, yes, yes. I've used her several times before, and I really like her. And she doesn't do you just a pet reading. She's reading you too. So it kind of takes you back when she's doing you too. So yeah, I think a lot about her, Patricia. I think she is great. So I would love for you to check her out, but I feel like there's something that's not showing up yet, and I would like for you to get a jump on it. I hope that helps, and I mean, you know, older pets are, you know, you start trying to find what's going on with them, and sometimes it's just aging as we age. Okay, let's see. All right, let's see who's next. Yet another Linda. Hi, ladies. How's the health of my third eye? Good question. Let me see. Thanks for your guidance. He said he plans to live to 23. Oh gosh, wow, look at you. My cat, everybody doesn't know, my cat, Dirty Harriet, just passed away last week. She was 17. She will be missed because she was my energy controller of the house. Okay. So look at you, 23. All right. I'm feeling like your third eye is pretty good. What I'm seeing though, in your third eye, which is different, is this radiation, not radiation, like rays coming off of your third eye. So I think there's some more opening that's getting ready to occur. Oh, thank you. Yeah, yeah. Dirty hair. Yeah, it's going to be 17 years. It's a long time to have a pet. It's unfortunate to have her that long. Okay, let's see. So what I'm just seeing, I think you're getting ready to open up the third eye more is what I'm seeing. And there's is rays almost like there maybe this is fractures I'm seeing that it's getting ready to open up more. But the third eye is fine. It's just getting ready to expand, and that's what I'm getting for that. So just prepare for say be prepared for a few headaches in the future. Oh, Stacey, you've had your Himalayan cat for 21 years, Angel? No, lucky you. No, Nana, it, I, Dr. Gill, could it be that the loss of your cat, who you say is the control center of your house, is why you are not feeling well? We lost our black lab about a month ago. A very difficult. Yes, I think a lot of it. I think a lot of it's mourning, but also allergies. I think everything's added to it. So it's such a loss of something that's been a part of your life for so long, and our pets are like family. So yeah, I think it definitely has a part of all of it. And thanks for asking. And I'm sorry about your black lab. I know it's very difficult. Yeah, I'm wondering, since she has been in my life and she's been the energy controller, she even would come in here when the energy wasn't right when I'm on a chat and take care of it. And so, yeah, I'm hoping my dogs will pick that up, that duty up now. Okay. Linda say, yes, you were, sounds great about the third eye, except for headaches. Thank you. Yeah, just prepare for a few headaches. And they didn't say one. I was expecting them to say one. They said a few headaches, but it looks like it's just splitting, getting ready to open up wider. And that's kind of exciting in itself. It's worth the headaches. Okay, let's see who's next. Looks like it's Mousy Girl. Okay. May I have a clearing and a healing? Okay. Mousy Girl, let's see what we've got going on here. I am seeing you needing a clearing out of your crown chakra. So I'm going to give you clear quartz. We're clearing out the crown chakra, and it looks like the input of, now a lot of times when I'm seeing the clearing of the crown chakra, a lot of times it's your electronics in your house that you become more sensitive to it. Or if you're in an apartment building, you're sensitive to the electronics. And that's what I'm getting a yes on you, Mousy Girl. Pay attention to your phones, your computers, your TV, um, everything that's an electronic device in your house. And you're needing to put some, I can never remember the name of it when it's time to remember to put some name on it. Everybody help me out. What kind of little tabs did you put onto your computers and electronics um, to dissipate those rays or those things coming off? What is it called? It starts with S. What stone is that? Shungite. Thank you. Shungite. That's it. Shungite. Mousy Girl, get some shungite. You can order it or you can get it in little tabs and stick it to all your electronic devices. And that will dissipate the effect that it has on you. And as we start ascending more and more and start more moving towards a different dimension, these tiny things start affecting us more. So what they're showing me is that you're needing to do that right now. If you haven't already done it before, there must be, or if you have a new device, there's something that you're needing to dissipate that electronic energy coming into your crown chakra right now. I just cleaned it out, but that's going to be your prevention to do that. All right. So next, Suzanne. Can I get a body scan, brain scan, just to ensure the brain is present? Okay. Make sure the brain is present. Okay. Okay. Well, okay. They're immediately showing me the heart chakra, Suzanne. So I'm going to send you this green Andorra, Andorra, Andera. It looks like these are just old wounds, Suzanne, that just need to be healed. I think we've addressed that before, haven't we? Heart chakra. looks like these are old wounds, Suzanne, and it's almost like the cycle. And this is true for all of us. When we have these certain wounds that we think we have healed, and it resurfaces over and over and over again. It gets a little better, but you're just like going, here it is again. Here it is again. There it is. Why is it back? Thought I'd taken care of this. Thought it was gone, done with, done. But it does keep cycling back, keeps raising its ugly head. And it looks like to me, Suzanne, that's what's going on with you. Some old issues are just raising its ugly head again right now. Like you're just needing to address. It will be easier to address it this time. But it's whenever we always have the perception of when we cut ropes and we think we've dealt with something, it's gone forever and it should never come back. Well, that's the idealistic thing to think of, but the realistic is that it does come back. It does resurface. It does resurface when a certain wound happens again, or something is said, or something that triggers you. It's not as bad, but it does resurface and you have to deal with it again. So whenever it does happen, don't look at yourself and punish yourself and think something's wrong with me. I thought I dealt with it and I thought I got rid of that. And you probably did, but it does resurface and it does come back and you do think about it. And it might take this time where it might have taken you years to get rid of it, might take you a day. But it's just also a reminder of what has happened to you in your past. Suzanne, you thought it was going well. I have been very frustrated lately. Yeah. Well, that's all it is just resurfacing it. Yes. Healing in layers. Thank you, Linda. That's the perfect word, healing in layers. And that's what needs to happen. Instead of it being cut cords, done, gone, no, it comes in layers, like Linda's saying, it comes in layers and it's going to resurface and you cut it off again. It's going to resurface again, cut it off again. But it just doesn't, it's not realistic to think a wound that you have been working on for years is just going to go away in one or several types of healings. It's just going to resurface when something else comes to mind or something triggers up. Okay, let's see who's next. Okay, I'm probably really out of order now. I'm actually surprised I've lasted this long without going into a real coughing fit. Okay, looks like it's Stardust. Hi, Dr. Gail. May I please have a scan and a healing? I could sure use the help. Sorry, you're not feeling well. Thank you, Stardust. Thank you. I've actually taken really advantage of taking this time off. It happens to be it's like Terry's out of the country and I got sick. And I'm going, well, I think this means I'm going to be taking some time off too. So anyway, I've had a few days off and I actually don't feel bad. It's just I sound bad. Okay, so I would like to have a little more information on what's going on with you that you said you could sure use some help. So is it just lack of energy? Because that's what I'm hearing that you're having is lack of energy. So I want to get a little bit more information on that because I want to make sure I go in the right direction. So Stardust, are you here? Okay, Stardust, I'm going to move on to the next person. If you could just let me know a little bit more detail. Oh, there you go. No, you're extremely blocked. Okay. That's what I'm getting is low energy, extremely blocked. Okay, let's see what's going on with that. You did this to yourself. You closed down yourself. Something scared you. Did you come in contact with something that scared you, Stardust? Yes, you did. Okay. Well, you shut it all down yourself because you got scared, and understandable. There's nothing wrong with shutting down when you get scared of something and you don't know how to handle it. But you've got to remember that you are stronger than anything that's out there. You can say, boo, go away. Of course, I'm doing it. So I yell at them, get out of here, cuss at them, tell them to go away. It might be that you need to really talk it out. It's layers and layers of shocks and traumas that you've dealt with, Stardust. Yeah, well, you have just shut yourself down, and it might be that you need quite a bit more help with that. You could probably use somebody can regress you back, or a shaman, or maybe I can help you. But it looks like to me there'll be a lot more. The forces came at my power that were beyond my abilities to handle. Well, that's when you seek out help. You seek out help from people. There's people that handle those things. I handle those things. Quite a few people handle those things from forces. We are here to help you on these things because we are here to help the light workers. And people do go through some attacks, and they do scare you and you shut down. And that's what they want you to do, is shut down. But we're here to help you get through those things. As I said, there's shamans. You can contact me at Dr. Gail Starseed at gmail.com. I can help you through that, or you can find a shaman that can help you through it. But there's a lot. Do my glasses have? Oh, well, I'm telling you what's going on, Stardust. But this is what I'm getting. You need to find somebody. You need to find a support system that can help you through it. And whenever something like that happens, you can contact them and uh, and find out how to handle it, and to have readings on it. It's not quite as simple as poof, it's gone, because poof, it's gone. You need to have tools to make sure he doesn't come back. So there's a lot more to it than just getting rid of it whenever you're starting out and having to deal with things like that. So that's what I'm recommending, is that you contact me, contact somebody you know that deals with like negative entities or implants that can get rid of those things. And your galactics, I mean, this is the message I'm getting from, is that you shut it down because you got scared, and that you're needing to have help to get through this. So that's what I am recommending, and that's your galactics, and that's your guides and my guides, and everybody recommending that you're needing some tools because you're getting um, shining brighter out there. They're seeing your light. That means that it's easier to come in for an attack, but you've got to have some tools to take care of it, and you have to have somebody or some people that you can contact to help you get through it. And as I said, it's not as simple as poof, it's gone. You need to have tools to just keep them away. Okay. Sorry. Felt like I was lecturing you, Stardust. I didn't mean to lecture you like that. Just trying to help you. Okay, Rossi. May I have a scan and clearing? Okay. Yes, Denise Shea is a shaman. I'm not sure if that's something he deals with, negative entities and things. You might want to check or email him about that. But otherwise, I know two that do deal with those that you can help. Even Mary, who's a shaman, can also do that. She'll be on, I think she's on next week with me. We were supposed to be on Wednesday together, but I couldn't talk, or nobody could understand me when I talked. Let's see. Rossi, I'm just getting something between like the heart, the solar plexus, the sacral chakra. I'm getting all of those. Yeah, Viviani does clearings. Yeah, she'd be strong enough to do them. Okay. I'm just hearing there's a connection between all three of those right now. The heart, and I'm feeling like it's a battle within yourself, Rossi, that it's almost like your heart wants to do this, your solar plexus say I should do that, your sacral says I want to play, and you're having this internal battle with all of them. I don't know if that's true, but that's what I'm seeing. Let's see what they're wanting to do about that. Okay, it's the connection between all of them. That's what's the problem is they're all each acting individually on their own, or they're not connected to each other. So, okay, I'm going to be giving you this, and it's all the chakras, but it's going to connect all the chakras together so they can at least speak to each other instead of fighting each other. Okay. All right. Let's see who's next. SSW, excited to catch you live. Oh, good for you. I'm glad you're here. And thanks for joining us. Okay, looks like this Liz and all. Hello and blessings. My vision is getting really bad, as is my lower back neuropathy and hands and feet. Thank you. So, Liz, well, it's like, to me, it sounds like all nerve. They're telling me being in this blue light is going to help that. Ross, it looks like you want to do a lot of things. Yeah, you do want to do a lot of things, but each chakra was acting individually, not together. Okay. Let's see about this vision and neuropathy, because I'm hearing it's all kind of neuropathy type things. Listen, are you having issues with your blood pressure? That's what I'm hearing. This is a blood pressure related issue. So I don't know. If this is a blood pressure issue, it seems like it seems kind of strange that it would be neuropathy that it's showing up like that. I'm not sure why that would happen. Maybe it's the lymphatic system pressure. Okay, here we go. Lymphatic system type pressure. That's what it's talking about. Okay, so there's some things that you can do for your lymphatic system. I don't know if you're already doing it. Mousy Girl, I think I've already done you. You're going to have to go back and look at the show. I think I did you. I'm not sure if I did, but it seems like to me I might have already done you. Okay, Liz, are you having some blood pressure or pressure issues with the lymphatic system? Thanks, Suzanne. I have done her. Yeah, just go back, Mousy, and look at the beginning of the show later. Okay, that's what I'm going to say is pay attention to your lymphatic system. If you're here, Liz, or if you're watching this later, pay attention to your lymphatic system. It needs some attention, and that's a lot of what's going on with you. There are a lot of videos on how to handle that. So talk, on YouTube and things. So go ahead and look at those and try to work with your lymphatic system. Patricia, I wonder if that is a mantis being a praying mantis on there. It's cute, isn't it? All right, I'm going to take this one last question. I just think it's amazing that my voice um, has actually held up so far. All right, let's see. I'm going to see about you, Patricia. If you have time, please scan men in more discomfort, arthritis, and now sciatica. Oh gosh, sciatica. That was, I hate to say, that was always a nightmare when people came in with sciatica. That was probably in in chiropractic. That was probably my worst thing was the sciatica. It's just because people came in so much pain, and the sciatica was so bad, and so um but your medical Mike's going to go over because he's showing me L5S1 is an issue on you right now, and he's going to go over and adjust that. And that's what I'm hearing him say. He says, I've got this. So, Patricia, he's going to go ahead and adjust that. And the discomfort and pain is now sciatica. I'm so sorry. Sciatica, when it gets to sciatica, it's really tough to back out of that. You have to be so careful with it. Because you thought you saw him behind you. Okay, good. All right, everybody. I have to end that today. Thanks for being here. Thanks for joining me. I'm shocked that my voice has held out so long, but I will be back on again. Actually, I'll be on Wednesday on Val's channel, Val's Dragonfly Crystals. I'll be on her channel on Wednesday. So join us there and we can answer your galactic questions at that time. So thanks everybody for being here. Thanks everybody and have a good weekend. Thanks for moderators for making this a safe place and we'll see you later. All right. Bye-bye.